Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Our guest in studio today is returning to speak with us about the power of peak state. He's here to talk about massively enhancing our personal potential, both on a business, professional, and personal level. And in studio today with us is returning Dr. Akram Alashari, and he's the youngest, one of the youngest, to become board certified in general surgery in the United States. Welcome again to Health Professional Radio, Dr. Alashari.
Thanks so much for having me, Neal.
Thank you. You're also, in addition to being one of the youngest folks to become board certified in general surgery in the United States, also a trauma surgeon, surgical intensivist, you're also an author, the author of The Power of Peak State, Massively Enhance Your Personal Potential. Why did you write this particular book?
The reason I wrote it is because I found that this state of being, the peak state, has massive impact on people's lives, and I felt like it was necessary that this knowledge get promulgated. I was speaking to many people about it during my rounds and throughout the hospitals, and many people said, we've seen such an impact and such a change with this, you should write about it and make sure everybody hears about this and feels the effects of it. And so that really inspired me to write the book.
Now, what type of reception have you received from other in the healthcare profession about how the book has maybe enhanced their performance?
I've actually had a lot of positive feedback from my patients themselves, and they've actually used the concepts in the book to overcome illnesses.
Wow. Okay, so not only did it help you in your medical endeavors, but it can also help patients to overcome the disease that you may be helping them with, or any other healthcare provider. How does that work?
So oftentimes I have my post-operative patients, and they're trying to recover from their surgery. And there's a lot of effort that's needed on their part, such as getting out of bed and such as doing deep breathing exercises. And these things are difficult because of the fact that they're having post-operative pain. And so I have to manage their pain with medication, but then getting them to participate in their care and getting them to enhance their mindset allows them to recover more quickly and have a higher quality of life.
So not only does this apply to, helping with you physically, mentally, as far as, coordinating efforts in the workplace, what about study in school? You're studying for a certain test. Is this peak state, do you have to be focused on one thing, or can you apply it to any endeavor that you embark upon?
Yeah, it applies to anything that you're trying to accomplish. You can apply peak state. So peak state puts you in a state of mind and a physical state where you're at your peak mentally, with clarity of thinking, increased energy, and increased focus. So you apply that to your studies, and you'll find that your memory is better. You'll find that you recall what you're reading, that you're able to be more creative, and you find that it improves your ability as a student in academics.
Now, is this something that you find older people, more mature people are more easily receptive to the techniques to achieve this peak state of performance, or is it something that covers any age group?
I think it actually can apply to the younger population with regards to their sports peak performance psychology, and it can apply to the more older, mature population with regards to their career endeavors or interpersonal relationships, because the concepts apply to whichever endeavor you're undertaking. And your understanding of it will change with your level of maturity and with regards to whatever you're going after.
So let's talk about healthcare. You talked about your post-surgical patients. Once they're home and their care is going well, how often do you integrate their aftercare, I guess for lack of a better term, write a prescription to practice some of these techniques in order to maintain the good health that you've given them through your efforts?
Yeah, oftentimes, when I see them in the office and maybe the acute illness is over, but then they still need to maintain a healthy lifestyle, or maybe they've been diagnosed with something that's not they found to be not curable, such as cancer or something like that.
Mm-hmm.
And so them maintaining this mindset, what it does is it dispels all negativity and it increases your passion and increases your enthusiasm for living and for whatever goals you want to achieve.
Mm-hmm.
And so oftentimes they will face depression because of their illness, so they use the concepts in peak state to overcome that as well.
Are we just talking about meditation here? Or is it something deeper or totally different, or a combination of meditation and something else?
It's really what it is enhancing your self-awareness, so knowing yourself very well,
Mm-hmm.
knowing what your values, beliefs are, and then finding out what it is you want out of life, and then putting those two in alignment. And then once that's in alignment, you use all the techniques to get into peak state, so that you can achieve your goal, so that you can self-actualize and that your dreams can come true. That's what peak state is all about.
Now, as a medical professional, with accolades, I can't begin to name them all here, and an experience that spans quite a few years in many disciplines. In your experience, how often is this peak state attainable by someone who's had a problem with substance abuse, or who may have become addicted to painkillers and, wasn't just doing it recreationally? I mean, once a person has been involved in some type of substance abuse, can they reverse that and still be able to attain this peak performance and possibly reverse some major life decisions? Is that a possibility? Have you seen that happen?
That's a great question, Neal. And oftentimes, because of my patient population, a lot of my patient population tends to have drug abuse and alcohol abuse problems.
Mm-hmm.
And so what I tell them is that they need to focus on, what they're really here for. What were they put here on the planet to do?
Mm-hmm.
What's unique and special about each individual, each one of us? And finding that what is it that we're passionate about, that you love to do, that you were born for.
Mm-hmm.
And then putting all your effort, all your focus, and all your thinking on that. And so those with drug abuse problems, those with alcoholism, when they get those cravings, those urges, to remind themselves why they're here and to redirect their thinking and redirect their focus and expand their mentality, so their horizons recede and they can have a wider, broader way of thinking,
Mm-hmm.
more hope and more compelling future for themselves.
Let's talk about your website. Do you have a blog at your website that describes, examples of this peak state in action? Maybe some stories about how it has enhanced a particular person's life at this website?
Yeah, absolutely. I put out audio as well as written content on there, and oftentimes what I'll do is I'll take scenarios where I'll have a patient who has suffered an illness, mm-hmm. and I'll talk about the perspectives involved and how much of that is actually affecting the patient, more so than the illness itself. And I'll give you an example. Mm-hmm. I had a patient who I found to be very, very anxious to an extent that was kind of did not correlate with the severity of her disease.
Okay.
And I felt concerned, and I said there was something deeper. And so I spoke to her, and I was able to elicit the fact that she was more worried about the expenses of the hospital stay more than her illness itself.
Okay. And sometimes that's understandable, if not necessary, it's still understandable.
It's absolutely understandable.
Mm-hmm.
And that's a common problem that I see. And so I try to redirect focus towards the fact that if you don't have your health, then you really don't have anything. And that higher levels of anxiety are associated with poor wound healing. And so I need her to have a good outcome from her surgery. I need her stress levels not to be so high. But I have to elicit what the cause is. Mm-hmm. And a lot of times it's not the illness itself.
So not only do you offer techniques and examples of attaining this the power of this peak state of performance, you also offer techniques on how to identify certain stressors and equaling the amount of that stress with something opposite, say your skill or your desire to do something different.
Exactly. It's just the power of peak state. The power comes all in controlling your mind, controlling where your thoughts go, and controlling your levels of stress. Because remember, it says it's not stress that kills us; it's our reaction to stress. Mm-hmm. So taking that stress and utilizing it in a way that can enhance our abilities rather than stress being detrimental to our physical bodies.
And tell our listeners where we can get a copy of The Power of Peak State.
Yeah, you can go to the website, thepowerofpeakstate.com, and there's a page just for the book. It explains the book, and you can get it through there. It's also available on Amazon online and through CreateSpace as well.
Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neal Howard, and we've been in studio today talking with Dr. Akram Alashari, trauma surgeon, surgical intensivist, and author of the book, The Power of Peak State, Massively Enhance Your Personal Potential. Dr. Alashari is among the youngest to become board certified in general surgery here in the United States and gives lectures and talks on how to attain this power of peak state throughout the country. It's been great having you here with us today, Doctor.
Thanks so much for having me, Neal. I appreciate it.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.